Our next speaker is Professor Dato Dr. Andrew Mohanraj Chandrasekaran, who will give the keynote address. Dr. Andrew Mohanraj served the Ministry of Health in Malaysia for 12 years before taking up an international assignment after the Asian tsunami of 2004. As a consultant psychiatrist and mental health development advisor, he's done pioneering work in the establishment of sustainable psychosocial rehabilitation services in Indonesia, the Philippines, and Timor-Leste. His main achievement in these countries was the campaign for removing physical restraints from people with chronic mental illness. In 2012, Dr. Andrew Mohanraj returned to Malaysia excuse me, under the Return of the Expert program by Talent Corporation, a unit under the purview of the Prime Minister's Department. He subsequently joined Perdana University Graduate School of Medicine as an associate professor in psychiatry and its first director of general clerkship. He continues his consultant work for local, international government and non-government organizations. Dr. Mohanraj also served 2 terms as a member of the Mental Health Promotion Advisory Council to the Minister of Health, Malaysia. In 2013, in recognition of his international work in the promotion of the United Nations Convention on the Rights of Persons with Disabilities, he was appointed by the then acting Minister for Community Development as a member of the National Council for Persons with Disabilities, in which he served 2 terms consecutively. Besides running his psychiatric practice in Mongkiara, Kuala Lumpur, he is engaged in periodic consultancy to provide mental health services to refugees and asylum seekers whose intended destination is Australia. He is also actively involved in the mainstreaming of mental health issues in Malaysia as the president of the Malaysian Mental Health Association and policy advisor to the Green Ribbon Group, Malaysia. He also begins his 2nd term as a member of the board of directors of the World Federation for Mental Health. Since then, he has taken up an academic position as adjunct professor of psychiatry at Taylor's University Medical School in Malaysia. As an animal lover, an advocate for animal rights, he has recently taken up the challenge of assuming the post of president of the recently registered Society for the Prevention of Cruelty to Animals in Malaysia. Beginning July 2021, Dr. Andrew Mohanraj has taken up a consultancy with the World Health Regional Office as a mental health and substance abuse consultant. After this talk, we will have the group photo session I mentioned, so remember to pop on your cameras for a few minutes. I hand you over now to Dr. Mohanraj for the keynote address.
Thank you, Tom, for that very generous introduction. I must also express my pleasure here today to listen to Peter Mabbott again. And I did enjoy what he said and what his reminder to us about the importance of compassion, and that compassion does make a difference. Thank you very much, Peter. Indeed, without compassion, none of us would be here. In fact, that would probably be the most essential quality of mental health professionals. With that, ladies and gentlemen, a very good afternoon to all of you. And indeed, I was very impressed when first Tom and then later Peter did mention that there are more than 500 participants in this 2-day conference. That's remarkable. Indeed, I participate in conferences almost like, one in a week, sometimes as a speaker and sometimes as a participant. And I can tell you that in recent history, I have not come across any conference that has had 500 participants. So congratulations to the organizers. It gives me a great pleasure indeed to deliver this keynote address in this international conference in clinical communications and hypnotherapy organized by the London School of Clinical Hypnosis Asia. Before I get on to what I have to say, perhaps I would like to make a small correction in what Tom mentioned just now. At the time of agreeing to be a participant in this conference, I was then still a consultant with the WHO regional office. However, I have just about recently ended and submitted my report as a consultant to the WHO, and I'm looking forward to another consultancy. So that's a minor correction that must be made, but just to put the record straight. So this two-day conference, ladies and gentlemen, covers a wide range of topics in the context of discussing the role of hypnotherapy in revolutionizing healthcare. Now, a revolution in healthcare is really the buzzword now. We can anticipate a drastic change in the way things are done, from diagnosis and monitoring health conditions through digital means, delivery of health care or in a virtual platform, storage of data and records, and even delivery of medications, all leading to greater empowerment of the end user and the narrowing of the treatment gap. Undoubtedly, COVID-19 pandemic played an important role and that's more out of necessity in many of these out-of-box solutions that are being formulated now. So what does this mean for the provision of mental health services? What sort of revolution are we going to see in mental health care delivery system? And before we discuss that, it is imperative for us to quickly run through some of the salient features of the mental health consequences of the pandemic. Now, we saw an increase in cases of depression, anxiety, and stress. We have figures to prove this internationally as well as in Malaysia. There's enough literature published to support these findings. However, there were also increase in recorded cases of post-traumatic stress disorder, a relapse in cases of chronic mental health conditions like schizophrenia, major depression, obsessive compulsive disorder, and substance-related disorders, including nicotine dependence. Now, we do not need figures to tell us all that. It is given that isolation and movement restriction and increased demand in services would naturally lead to the sorry state. Tragically, we also saw higher numbers in suicidal thoughts and in cases of completed suicide. And this was not only in Malaysia and in the region, but internationally too. In Malaysia, as well as in other parts of the world, including our closest neighbors, Singapore and Thailand, we struggled to provide mental health services to those in need. In Malaysia, it was a double whammy because we had unprecedented floods hit several parts of the country right in the middle of the pandemic. The focus then was to provide acute mental health services to those affected, particularly to those who were internally displaced. Now, in this process, we learned that many with chronic mental health conditions were left out and cases of relapse rose. Unfortunately, some with fatal consequences. While the often repeated statement that we do not have adequate mental health resources in the country was again used to explain why all those in need of help could not be covered, little attention was paid to the reality that human resources were at times poorly deployed. For example, there are more than 20,000 counselors attached to educational institutions, that is the formal education, or rather the government education institutions in the country. But the task of reaching out to those in need was given to the mental health staff of the Ministry of Health. there was no clear task shifting to download the responsibilities of psychiatrists to general practitioners and other health professionals like nurses, social workers, and practitioners of hypnotherapy. However, these are lessons learned, and we are now forced to have a relook at health and mental health services and find ways to optimize services so as to narrow the treatment gap. I suspect this is the case in the region and in other parts of the world as well. Now, ladies and gentlemen, how does hypnotherapy then fit into this proposed paradigm shift in the provision of mental health care? Can hypnotherapy be a stakeholder in this revolution that we are going to discuss in this two-day conference? Can hypnotherapy be a bridge between many therapies offered, ultimately empowering patients to take control of their own physical and mental well-being? Additionally, how does hypnotherapy contribute towards meeting the mental health demands of society in the field of education, business, and artistic pursuits? I mean, these are some of these questions could be a bit heavy, but I'm fairly certain that they're going to be addressed in this two-day conference, and some might be very specific, and some are broader areas of discussion that I hope the participants of this conference will find time to discuss. The role of the role of the hypnosis has been recognized for hundreds of years, resulting in understanding that altered states of consciousness can promote healing. Indeed, the close connection between mindfulness and spirituality has also contributed to the acceptance of hypnosis as part of therapy. Today, the usefulness of hypnotherapy is well established in habit control, pain reduction, stress management, smoking cessation, and depression, not to mention eating disorders, skin conditions like psoriasis and eczema, and even bedwetting in children. These are some of the conditions that I am familiar with, and in some cases have made referrals to practitioners of hypnotherapy. But I'm sure there are many, many more other conditions yet to be discovered as well. Now, hypnotherapy also has been used in surgery without anesthesia, or even to complement or enhance conscious sedation. And studies do show that activation of analgesia and hypnosis is superior to just only using pharmacological anesthesia. And there are a number of studies as well published in prestigious journals demonstrating that the pain pathways show incredible results or changes. And this is in evidence of hypnotherapy, again, as being a reliable modality of treatment. Just now, Tom actually stole the thunder in my presentation by mentioning our very own Tantri, Dr. Mahadevan, one of our pioneer psychiatrists in our country, as well as a fine son of Malaysia, who conducted or assisted in the conduction of a surgery of a road traffic accident victim in Dublin about 40 years ago. So I shall not go into details of that because Thomas explained everything quite in detail. But the fact is that 40 years ago this was done. Clearly shows that there is a clear, precedent to this, and yet, despite this happening 40 years ago, clearly there's a lot of work still needs to be done in establishing hypnotherapy as a very definite modality of treatment in the spectrum of treatment offered in mental health. In my own area of interest, that is disaster psychiatry, and in mental health of refugees and asylum seekers, who present not only with depression and anxiety, but even in those with post-traumatic stress disorder, hypnotherapy has been used with remarkable success. And I note that in this conference, it will also highlight the successful use of this modality of treatment to complement many other medical and surgical interventions. And I look forward to listening to these presentations. Ladies and gentlemen, I would also like to caution practitioners as well as students of hypnotherapy that the very fact that hypnotherapy has proven to be effective only means that there are also dangers in applying hypnosis indiscriminately without regard to the dynamics of the patient's emotional problems or overlooking the patient's psychiatric diagnosis of severe mental disorders. There are also some indicators of personality traits linked to greater acceptability of this modality of treatment. The neurotransmitter GABA, GABA, or gamma aminobutyric acid has also been linked to hypnotizability. And researchers have found that highly hypnotizable people have higher levels of gamma in the part of the brain that is thought to be closely involved in hypnosis. This part, or this region of the brain, where the anterior cingulate cortex is situated, is involved in cognitive control and volition. And this again further establishes the usefulness of hypnotherapy. I also note with great interest that the all-important question, what next, is also covered in the second day of this conference. So how do we position hypnotherapy as a modality of treatment in the structure of mental health care and services? Now, mental health professionals need to take a holistic approach in intervention and to recognize the complementary role played by various modalities of treatment, including hypnotherapy. The mental health professionals who practice purely biological interventions, and I can tell you there are far too many of mental health professionals of such persuasion. They need to recognize the fact that hypnotherapy also enhances biological interventions, and therefore this complementary approach in reality works in the favor of those who are unshakable in their belief that it is only biological interventions that work best. For this to happen, adequate training, or at least some exposure in the principles of hypnotherapy in specialty trainees need to happen. For example, in the training program in general psychiatry, clinical psychology, or surgery and anesthesiology, this exposure of the principles of hypnotherapy should be mandated. Other challenges like insurance coverage for hypnotherapy treatment needs to be looked into, and at times appropriate legislation may be also need to be considered to give worthy recognition to the field of hypnotherapy. And this is not only true in Malaysia and in the region, but in many other countries in the world continue to struggle to have hypnotherapy recognized as a modality of treatment for insurance coverage. Now, well-structured courses that produce practitioners of this modality to complete the mental health landscape in Malaysia and other countries must also, in my opinion, eventually result in accountability to a professional body, just like other mental health professions. So these are some of the challenges I see ahead. And I do hope this conference will throw up some suggestions as to how we can together take this agenda forward. In this regard, the LCCH Asia must be congratulated for the provision of advanced certifications and diploma in clinical hypnotherapy. Personally, I would like to see practitioners of hypnotherapy working hand in hand with other mental health professionals and to be an active stakeholder in reducing the treatment gap in the provision of mental health services. This holds good not only for Malaysia, but for many other parts of the world as well. Finally, I would like to congratulate my good friend Sheila Menon and her team for putting together this very timely conference. My only disappointment is that I have been deprived of the opportunity to participate in a physical, face-to-face conference where I would have had the opportunity to interact with some of you. But who knows, in the next conference, perhaps I would be blessed with such an opportunity. The pandemic has certainly changed the way we do things, and there are some things that are here to stay. I would like to wish all of you the very best for the conference. Thank you very much, and terima kasih.
Thank you, Dato Andrew, for a very inspiring opening presentation and sharing your vast experiences with us. We deeply appreciate you having joined us today. I just have a couple of questions that I'd like to put, and I'd like to just invite the audience. We have about 10 more minutes or so. So if you have any questions that you'd like me to put to Dato Andrew, please do submit them into the chat. Dato Andrew, just a question for you. What is your experience of compassion in healthcare?
Oh, it's a very interesting question, at the same time a bit difficult question to answer as well, in the sense that it is very challenging to keep compassion sustainable. And let's be honest about that. Indeed, I recognize that all mental health professionals, and some more than the other, depending on the field in mental health they work in, would have, by necessity, remind ourselves to be compassionate. And as much as it is our core values, we can also learn and unlearn and remember and forget compassion. And therefore, it is always important for us to understand that compassion not only helps us in our work, in reaching out to the most vulnerable of people, but it also helps us maintaining our own well-being and to understand how we position ourselves in this whole in this whole dynamic situation. I think it helps me maintain my own mental well-being, keeps me enthusiastic, and maintains my enthusiasm in the work I do. And all of us as mental health professionals understand this, I'm sure. And as it was reminded to us by Peter just now, and so beautifully and eloquently expressed by him, without compassion, we really cannot move forward in anything we do. And without compassion, we may be able to carry on providing services, but for how long and with what quality? And therefore, we have to understand that compassion is our core value. And that is what I hope to, to impress the audience here today.
Thank you very much. That was a great answer, and very inspiring. And indeed, it's good to know that people such as yourselves are out there, impressing upon the healthcare industry, if you like, that the importance of compassion. So thank you for that. Dato Andrew, how do you feel hypnosis could have helped during the pandemic?
Oh, that's an interesting question, and I was hoping somebody would have asked that. You know, the sad thing is we didn't quite recognize the importance of practitioners of hypnotherapy during the pandemic. And in Malaysia, from our own experience, which I can speak authoritatively about, as well as, you know, based on anecdotal findings in other countries, is that had we been, what should I say, been clever in the use of mental health resources, then a great deal of task shifting could have been done during the pandemic to involve all practitioners of mental health, including practitioners of hypnotherapy, to reach out to as many people as possible. Now, that is one thing, to cover all the people in need. In addition to that, there are specific areas that would have had a demonstrated better outcome had there been a recognition or a request for practitioners of hypnotherapy to play a role. For example, we did see you know, high levels of depression and anxiety. Now, that could have been quite well tackled in, as you know, together with this whole spectrum of mental health professionals, including practitioners of hypnotherapy. There were also cases of PTSD, and in my opinion, in my practice, in dealing with refugees and asylum seekers, as well as internally displaced populations after a disaster, trauma and torture and trauma issues can respond, and people struggling with these issues do respond very well to hypnotherapy. And so it was a great tragedy for me to note that this resource wasn't adequately utilized by stakeholders during the pandemic. But these are lessons that we have learned, and in crafting out a more comprehensive mental health services in preparation for such events occurring in future, then I guess we would certainly have to have a relook at the kind of services that we offer.
Thank you. You know, I think we'd all agree that we'd like to say that you know, there's obviously always lessons to be learned from experiences, and hopefully we'll cope better next time. But hopefully there won't be a pandemic again, at least not for many years. So thank you for that. We've had a question, quite a very relevant question at this moment from the audience. How can we protect against compassion fatigue?
Well, what we do, what I tell my team to do, and as well as practice myself, is number one, I think there's a terrible need for all of us in mental health field to understand that we are not supermen or superhumans here. We do have our limitations, and that must be constantly reminded to us, either by ourselves or members of our team. I think this is the number one thing. And even if we feel that our limitations are, you know, much more pronounced than the limitations of our colleagues, for example, the fact that despite that limitations, we are doing good, the fact that we are in this profession means, in a way, we are the chosen people. You know, I don't like to sound so arrogant here, but the fact is, you know, I'm constantly reminded of my professor of psychiatry who, you know, kept saying that the fact that we have chosen to get into the mental health profession meant that we already have a place in heaven. So anyway, that's a little bit of a digression there. So I do feel that to understand our own limitations is the number one rule here, to prevent compassion fatigue. And number two, of course, to discuss our own, the advances that we have made in a particular case, the development of a clinical situation, our own limitations, and where we have faltered, where we have made gains. To discuss it in a group helps very much in our day-to-day clinical practice, and it certainly would prevent compassion fatigue. This is in my experience, and I make it almost an essential requirement. And if possible, sometimes this sort of sharing happens even, at least once a day, but at times it's twice a day, depending on the kind of situation and the area that we are in and the beneficiaries that we are serving. So I think that two ways of dealing with it has helped me and my team tremendously.
Okay, thank you, Dato Andrew. We've had not so much a question, but a comment, an observation has come in from someone in the audience today. I'll read it out to you, and it's from someone here in the UK. A comment regarding better use of hypnotherapists during the pandemic. In the UK, there was a call from various organisations for therapists to come forward to help frontline staff who were struggling following their work with COVID-19 patients. In my experience, i.e. the experience of the person who submitted this question, in their experience, they were told they weren't qualified. And this links back to the importance of professional bodies, which brings me on to another question I was going to put to you, probably relevant to this statement from this person, is should there be a standardized curriculum for hypnotherapy?
I agree with you that there must be, I mean, at least my opinion is there must be a standardized curriculum and something that has to be accepted by the various bodies that are going to recognize hypnotherapy as a modality of treatment. Now, while there is a recognition, there are two issues here really. While it is recognized by the profession, however, simply because it currently in many countries lacks a registrable status of a professional body, that somehow is seen as an impediment in one providing these services or practicing hypnotherapy. So I think that is really very sad. So the way to achieve a registrable status would to produce a streamlined, standardized curriculum, as much as this streamlined, standardized curriculum may eventually be so rigid as to prevent any, out-of-the-box kind of thinking. Unfortunately, in many countries in the world, we have inherited the system from the Commonwealth where, one has to be absolutely rigid and to be clear in stipulating what are the contents of the syllabus, which leaves very little room for a sort of out-of-the-box kind of a view of that learning experience. Nevertheless, this is the first step, and I think this is the way to go about it. And I would imagine even in Malaysia, I'll be quite happy to have further discussions with Sheila and her team to see how this can be, facilitated in the Ministry of Health. And, I strongly feel that this is the time to, we need to seize this opportunity now when there's a rethink about the role of various modalities of treatment. And, I did read that question that you read out just now, and it is quite upsetting for me to find that. And I tell you why it is more upsetting, not only because, they were sort of dismissed as being, what were the words now? It says that I was told I wasn't qualified. So that's that very kind of a dismissive, brushing it off like that is totally unprofessional and uncalled for, really. But what was more upsetting for me is, like, in our own experience in many of the countries in the region. I had a chance to review some of the interventions in Thailand, Indonesia, and the Philippines, and I was very closely associated and very much privy to what was happening in Malaysia as well. And I can tell you, with all this enthusiasm that was shown by various mental health professionals, some of the professionals, the mental health professionals who were supposedly recognized as mental health professionals, were actually dishing out interventions that were quite, what should I say, not very evidence-based, and also could have been counterproductive and dangerous as well. And simply because they had the credentials of being a mental health professional, what was in reality being implemented at the ground level was something that could have put people's mental health status in danger, and even causing some fatal consequences as well. So unfortunately, it also, for now, it seems to depend on what hat you wear, and if that is a sort of a hat that is recognized and registrable label that you have on your hat, then you can get away with whatever you do. This was one of the lessons that we learned during the pandemic, and all the more there was a need to not only streamline and understand and recognize that in this whole spectrum of services, we need to look at all mental health professionals and use them where it is needed to basically spread out the work. But at the same time, also there was a need now, and I can tell you this was a, Steve, this is something that has been discussed time and again, that some of the mental health professionals, supposedly, calling themselves mental health professionals, actually did things that were not acceptable by the large majority of us. And that was very, very worrying. So clearly in a pandemic, in any situation like that, monitoring and supervision is of essence. And it is a pity that some people just got away with doing things like that. So in future, we hope that it will not repeat itself. Absolutely.
And it's, sheds light on, like you say, the importance of regulation, supervision. And it's unfortunate that sometimes in so many things in life, it can be a minority that brings something into disrepute. Dato Andrew, on the subject of not being told that one isn't qualified, Silvana from Australia has made a comment, basically saying that they encountered the same thing in Australia. But it wasn't so much about the hypnotherapy training, but the inability to access Medicare. And therefore, hypnotherapy is only accessible to those who can pay, who can afford it. What are your thoughts on access to hypnotherapy treatment via insurance?
Yes, I think some, I can tell you from the Malaysian experience, to get insurance coverage for mental health care itself was a major struggle. In fact, that struggle still continues. And of late, there have been some strides made in the sense that we've got 3 or 4 insurance companies that have agreed to include mental health care in their coverage, but that is highly limited to a certain number of, a certain cost or a number of sessions. And for sessions with clinical psychologists, even that is highly limited. So we are now in the process of trying to, engaging with this insurance, the industry, as well as our central bank, which regulates insurance services, to see how these, other services can also be part, or other modalities of treatment can be part of this insurance coverage. But I tell you, it's largely out of pocket in Malaysia. even for, I mean, the entire spectrum to see a psychiatrist or a clinical psychologist, a counselor in the private sector, it's largely out of pocket. And we are hoping to improve that situation now. But Steve, I can tell you we have a very, very long way to go by the time we manage to include adequate number of sessions for hypnotherapy or counseling or even clinical psychology. This is what is happening in Malaysia, but I do hope that this renewed thinking and this situation currently now, I mean, there was a silver lining after the pandemic and the floods in Malaysia as well. And given this rethink on how we should proceed from now, I see some light at the end of the tunnel, and I would not rule out the possibility of hypnotherapy being included in this as well. Now, there is, of course, we have to be realistic here. Even if there is a sort of an acknowledgement here, there's a great possibility that only certain kinds of interventions might be recognized. And that would also depend on what is the current thinking. For example, if it is going to be used as an adjuvant for CBT, in depression, for example, that might be something to be considered, or for smoking cessation, which there are quite a number of reports which suggest that it has been helpful. So it would probably depend on the condition as well. So, so we do struggle with that in Malaysia, and I'm not surprised that even in Australia, while the discipline is recognized, but the insurance industry, needs to be brought on board, and greater interactions and consultations are needed for progress to be made.
Okay. Well, thank you very much. I just wanted to share with the audience, somebody else here in the UK made a comment. Jill Dearlove here in the UK says that she works, and this is more for the benefit of all the other UK members of the audience that we have today, that in the UK, Vitality Healthcare recognise hypnotherapy. And Jill says that she has worked very successfully with this insurer. So that's Vitality Healthcare for anyone who might be interested. Dato Andrew, it's now 9:50 AM here in the UK. So I'm now going to thank you very much, very sincerely. It's been my absolute honor to be able to interact and chat with you like this, and to have you give us your very valuable insights. So thank you very much. It's been an absolute honor and delight for the whole company, the college, that you have joined us today, and we give you our sincere thanks. And I shall now hand back to Tom. Tom, back to you.
Thank you, Steve. It was a pleasure. Thank you.
Thank you very much.